Medical Ethics and Health Law for Semester 9. During the 9th semester of medical education, students are introduced to the critical concepts of medical ethics and health law, which are essential in ensuring professionalism, patient-centered care, and legal compliance in medical practice. Below is a detailed explanation of each component. 1. Principles of medical ethics. Medical ethics is guided by 4 fundamental principles that underpin clinical decision-making and interactions with patients. These principles serve as a foundation for addressing ethical dilemmas in healthcare. 1.1. The 4 key principles. Autonomy definition. Respecting a patient's right to make informed decisions about their own health care. Application. Ensuring patients are fully informed about their condition, treatment options, and potential outcomes before making decisions. Example: a cancer patient refusing chemotherapy after understanding the risks and benefits. Beneficence definition. Acting in the best interest of the patient to promote their health and well-being. Application. Providing timely and appropriate medical interventions that prioritize patient welfare. Example: recommending life-saving surgery to a patient in critical condition. Non-maleficence definition. Avoiding harm to the patient, whether through action or inaction. Application. Carefully weighing the risks and benefits of medical procedures to minimize potential harm. Example: avoiding unnecessary diagnostic tests that may cause patient discomfort or exposure to radiation. Justice definition. Ensuring fairness and equality in the distribution of healthcare resources. Application. Treating patients equally regardless of their socioeconomic status, ethnicity, or background. Example: providing the same level of care to uninsured patients as to those with insurance. 1.2. Ethical communication with patients. Delivering bad news. Frameworks used. Spikes protocol. S. Setting. Create a private, quiet space. P. Perception. Understand the patient's perception of their condition. I. Invitation. Ask for the patient's preference in receiving details. K. Knowledge. Provide clear and honest information about the diagnosis. E. Empathy. Respond to the patient's emotions with compassion. S. Summary. Summarize and discuss the next steps. Key points. Use simple, non-technical language to ensure understanding. Acknowledge the patient's emotions and provide emotional support. Ethical challenges in communication. Balancing honesty with maintaining hope. Handling family requests to withhold information from the patient. 2. Health law. Health law ensures that healthcare providers act in accordance with legal frameworks while safeguarding the rights and dignity of patients. 2.1. Understanding informed consent and patient rights. Informed consent definition. The process of obtaining the patient's voluntary agreement to undergo a medical intervention after providing comprehensive information. Components: explanation of the diagnosis and proposed treatment. Discussion of risks, benefits, and alternatives. Assurance that the patient understands and agrees voluntarily. Application in clinical practice. Mandatory before performing surgical procedures. Administering anesthesia or enrolling patients in clinical research. Example: obtaining informed consent before a cesarean section, explaining potential risks like infection or hemorrhage. Patient rights. Right to information. Patients have the right to be fully informed about their condition and treatment. Right to refuse treatment. Patients can decline medical interventions, even if it may result in harm to their health. Right to privacy. Ensuring confidentiality of medical records and personal health information. 2.2. Medical malpractice and legal protection for healthcare providers. Understanding medical malpractice definition. A failure by a healthcare provider to meet the standard of care, resulting in harm to the patient. Examples of malpractice: misdiagnosis leading to delayed treatment. Surgical errors, such as operating on the wrong site. Medication errors, including prescribing incorrect dosages. Legal processes in malpractice cases. Filing complaints by patients or their families. Investigation by medical ethics committees or legal authorities. Determination of negligence and awarding of compensation if proven. Legal protection for medical professionals. Documentation. Maintaining comprehensive and accurate medical records to defend decisions in court. Good Samaritan law. Protecting healthcare providers who offer emergency care in good faith. Professional indemnity insurance covers legal expenses and compensation in malpractice lawsuits. Ethical legal dilemmas, managing conflicts between patient autonomy and medical recommendations. Handling refusal of life-saving treatment due to cultural or religious beliefs. Conclusion in Semester 9. The study of medical ethics and health law equips future doctors with the knowledge and skills to navigate ethical dilemmas and legal responsibilities in clinical practice. By mastering principles of autonomy, beneficence, non-maleficence, and justice, and understanding the legal frameworks surrounding informed consent and malpractice, medical students are better prepared to provide ethical, patient-centered care while safeguarding their professional integrity.